The virus is really hitting all of China at once. The forecast for deaths in China reached as high as over 2 million. China's road to reopening is a little bit like that Ernest Hemingway phrase, gradually and then suddenly. The pressure has really been building for a year now since the arrival of Omicron, because that variant is just so transmissible that China's classic playbook of lockdowns, mass testing was becoming less and less effective against stopping spread. Then there were these unprecedented protests that happened at the end of November, people taking to the streets, some even calling for presidency to step down. Since then, China has basically let it rip. All of these measures now have been overturned. The only thing that remains for China is these travel curbs that we expect to be eased quite soon as well. What we're seeing right now is that really initial stage of infection that we saw in so many other countries in early 2020, where suddenly over a couple of days, almost everybody is infected. What's really worrisome coming after this stage is when serious illness and fatalities will set in. There's a lot of concern over how the elderly especially are under-vaccinated, and they're vaccinated with Chinese vaccines, which we know are not as effective as the Western mRNAs. The health system is under strain. Officials are telling people, please don't come to the hospitals unless you're seriously sick. They're trying to prioritize the most vulnerable. The virus is really hitting all of China at once. I think we can see the same thing really happen in all major cities over the next 6 to 8 weeks. We'll start to see fatalities in around 4 to 6 weeks, and then the infection curve will start to come down. But as we've seen in so many other countries around the world, the waves keep coming back. There may be another variant, which is a really big unknown that experts are quite concerned about, because you're talking about 1.4 billion people. The more people get the virus, the more it evolves.